your coffee or a tea or a water. And obviously if you're fasting, then looking forward to later. And thank you for joining us this morning. Just to make you aware, as I always have to do a little bit of housekeeping, this meeting is going to be recorded. So if Mamun or Naeem can start recording, that would be fantastic. And it will be uploaded to our YouTube and our website. So of course, please feel free to share this information with friends and family. Please turn off your video if you are uncomfortable being recorded, and then just turn your video off and you're all fine. So everyone is going to be muted, and so we will mute everyone as well, just so that we can make sure we can hear the information. But at the end, of course, as always, we open it up to Q&A, so please feel free to unmute yourself and ask your questions. You can also post your comments or questions via the chat facility in Zoom, and you can also use the virtual hand up signal in the Zoom as well. Just a reminder, please do not post any links or images, and as that means we will remove you from the meeting. And just a reminder that we are active on social media. So our tag is ARCC Limited Ltd, and that's on Twitter, Facebook, Instagram, and YouTube. So Mamun, are you able to share the agenda? And I'll just quickly go through that. So it's a nice simple agenda today. So yeah, you've already had your housekeeping, and then we're going to be joined by Dr. Akunuri. We're very lucky. I'll quickly introduce him, and he's already got a brilliant presentation for us. And then we'll open it up to our Q&A. And then of course, everyone that comes to our virtual coffee mornings has a chance to win one of our mini coffee hampers. And then we'll just give you the dates of our next events. So thank you, Mamun. So let me basically just introduce you to sort of our session today, which is about high blood pressure or hypertension. And one of the things that we're doing this today is that it does not have very noticeable symptoms. So hypertension, if left untreated, does increase your risk of other serious problems such as heart attacks and strokes. And it is relatively common. Around a third of adults in the UK do have high blood pressure, although many will not realise it. So it's really good you've come along today. Basically, the only way to find out if your blood pressure is high is just to have your blood pressure checked. It is important, and one of the reasons why the Asian Resource Centre is hosting this today is that your ethnicity can increase your risk of developing heart and circulatory diseases. So if you're South Asian, African or African Caribbean in the UK, your risk of developing some heart diseases may be higher than other white Europeans. There isn't a completely clear answer as to why that might be an increased risk, but we do know that genetics are likely to play a part, as well as lifestyle choices. So there are obviously lifestyle choices that can help us prevent and lower high blood pressure. So we can obviously do things like reducing the amount of salt we eat, having a healthy diet, cutting back on alcohol, losing weight if you are overweight, exercising regularly, cutting down on caffeine, and stopping smoking. So these are the things that we probably already know about. So the brilliant thing with today is that we are joined by Dr. Akunuri, who is an expert on all these things. He's a general consultant in the acute medical unit at the Croydon University Hospital. So Dr. Akunuri, would you be able to talk with us and give our presentation about hypertension awareness, the risk factors, symptoms, things like that? Thank you.
Thank you, Lizzie. Thank you for inviting me to this forum. I hope all of you are able to hear me and see me all right. I'm a medical consultant. I work at Croydon University Hospital in the acute medical unit. I also do a blood pressure clinic, which I run every Wednesday afternoon on the HCOM unit. So I'm very delighted to talk about hypertension. I think Lizzie has sort of mentioned the crux of what I was going to say to you guys as well. I've got a short presentation, which I can run 10-15 minutes. But I think when I talk about hypertension, I think the question and answers are very, very useful. So if you have questions, please write them on a piece of paper, and we'll try to make this as interactive as possible. The presentation itself was actually prepared for me by one of my junior doctors quite few years ago, and it's a very good presentation, primarily for doctors and healthcare professionals. So there might be a little bit of technical detail in it, but I will try to keep it what's the right word? Will not make it too technical about it, and keep it as simple as possible. So Lizzie, if I can start with the presentation. So next slide, thank you. So during this presentation, we'll go through the definition, classifications, the diagnosis, some investigations, and management and complications of high blood pressure. And there is something called as secondary hypertension. Also, when it comes to the slide, I will explain what it is. Yeah, thank you. So definition-wise, technically speaking, anybody, if the blood pressure is elevated consistently above 140 by 90, you're known to have a high blood pressure. But I work in acute medical unit. We are on call quite often, and many a times I go to the emergency department to see patients, and their blood pressures are high because they are stressed, they are in pain, they are in distress. So whenever you diagnose somebody with high blood pressure, these readings should be consistent. Some people have said at least 4 independent readings should consistently show that your blood pressure is greater than 140 by 90 before we can say this patient has high blood pressure. So it's not an isolated reading when you go to a GP and they've taken one reading and the blood pressure is high. It has to be a multitude of readings, and it should consistently show that the blood pressure is high. Thank you. Next slide. There is no definite cutoff for hypertension. It's in population. It is sort of a the graph is what we say blood pressure is normally distributed. So everybody has a certain amount of blood pressure, but there are numbers above which we classify people as having high blood pressure. Next slide. So why blood pressure is very important is, the blood pressure has 2 readings, the top reading and the bottom reading. The top reading is called as systolic blood pressure, and the bottom reading is called as diastolic blood pressure. This basically comes from the fact that heart has got 2 functions. It contracts and relaxes, contracts and relaxes. When it contracts, the blood pressure is higher, that is the upper reading. When it relaxes, the blood pressure is lower, that is the lower reading. When you just consider the upper reading, even a tiny change of increase in blood pressure can have a 7% increase mortality from heart attacks, or 10% increase risk of mortality from a stroke. See, I see young people all the time in my blood pressure clinic. A lot of them don't even know that they have high blood pressure, and mostly they've gone to a GP for some advice, or they've gone to a pharmacist with complaints of headache, or they've gone to to their gym to register, and somebody has checked their blood pressure and it is higher. The thing which makes blood pressure dangerous is it's a very silent illness. A lot of people, if you have asthma, you have shortness of breath, you have wheeze. If you have chest infection, you cough. Yeah, if you have diabetes, you feel very thirsty, you pass urine a lot. But with high blood pressure, to a certain grade, almost when it is in stage 2, up to stage 2 and higher, sometimes patients can completely be fine, and they don't recognize it. So that's why it's a silent illness. Thank you. Next slide. Blood pressure is divided into 2 groups: primary versus secondary. Primary, the other term is what we call as essential hypertension. Majority of the population has the primary hypertension. Primary hypertension means there is no designated reason for it. it's multifactorial. It could be genes, it could be stress, it could be alcohol, it could be, there could be, you can't put one point and say, okay, this is responsible for the high blood pressure. And majority of patients fall in this group. There's a small fraction of patients who fall in the, say, if I say 95% of primary hypertension, 5% people fall in the secondary hypertension. And secondary hypertension, there might be problems with their kidneys, which is making their blood pressure go up. There could be a problem with their hormonal system in the body, which is producing excess chemicals and making their blood pressure go up. There could be some other anomaly with their heart or with their blood vessels, which is raising the blood pressure up. The secondary hypertension, mostly we try to find out in young people when they come to my clinic with high blood pressure. But majority of cases is primary hypertension. And the 5% of the secondary hypertension, their causes, there could be a problem with the kidneys where the blood supply to the kidneys is affected. There could be a condition called as pheochromocytoma. It's very rare. One of the glands in the body produces excess chemical, and you can have high blood pressure. Conn's syndrome, this is a condition where patients can have high blood pressure and the low potassium salt levels in the body as well. Next slide. Thank you. In elderly people, as you know, when babies are born, their blood pressure is very low, and as they age, the blood vessels become stiff and the blood pressure rises. As you age, you have higher chances of having high blood pressure. In older age, what we call as systolic hypertension. So it related to the blood vessel stiffening. In young people, in fact, I've seen this even in some rugby players, the lower reading is high, and they're usually below the age of 50. And patients always ask me, which is the most dangerous version? Is it the upper reading or the lower reading? A combination of both, but if you ask me, the upper reading is more important in controlling the blood pressure than the lower reading, but there's lots of different physicians say different things. Yeah. Stages of hypertension, just like any illness has a scale, and the scale is divided into mild, moderate, and severe, right? So even in blood pressure, you have stage 1, where the blood pressure is 140 by 90. That's we call as stage 1. Stage 2 is 160 by 100, and stage 3 is 180 by 110. I think there's a question somewhere. Somebody asked whether hypothyroidism can cause. Is that one? Somebody was asking a question. Can hyperthyroidism cause? Yeah, I think thyroidism, either high or low, can affect your blood pressure. Mostly it's the low blood pressure, low hypothyroidism, which can cause high blood pressure. But even when people are hyperthyroid, they can have high blood pressure. Yeah. So this is the staging. And again, just one reading. A lot of young people, below the age of 30, I don't want to give them treatment unnecessarily. And sometimes they've gone to a gym, blood pressure is high, and the GPs have started them on treatment. I think we just have to be careful. The readings have to be more than 2 or 3 before we label them as hypertensive patients. Yeah. Many other factors influence blood pressure: pain, anxiety, stress, exercise, technical factors like cuff. You have to use the right cuff for blood pressure. The other thing is, a lot of people, when they come to clinics or hospital, are stressed. So that may not be accurate reading of your blood pressure. That's what we call as a white coat hypertension. That's why when they come to clinics, we take 2 or 3 readings, and the readings are better if they're taken by nurses than by a doctor. And the other thing is, even when you have a blood pressure monitor at home, don't measure the blood pressure immediately after a jog, immediately after having a tea, coffee, or alcohol. You should be rested at least for 10-15 minutes. You should make sure your back is rested and your arms are rested. Then check your blood pressure. Ideally, at least 2 or 3 readings, 2 minutes apart, and that will that will be a more likely estimate of your blood pressure than doing blood pressure immediately after exercising or after a cup of coffee without resting and stuff. Thank you. Next slide. They are gold standard. Even when patients come to me in the clinic, I've stopped being too judgmental on their blood pressures, because sometimes they're falsely elevated because they've come to clinic, they're stressed, they didn't get their parking on time, they're worried they will miss the appointment. Sometimes they come in and they have to pick up their children from school. So the gold standard to know if a patient has high blood pressure or not is by doing ambulatory blood pressure monitoring, which your GP or I can order, but obviously the first contact would be your GP. But these machines are few of them. The number of patients with hypertension are quite a lot, so it's always difficult to ration them. The other thing is there are good blood pressure monitors you can buy from pharmacy. You can get a decent monitor, not too techno savvy, but a simple decent monitor for 25-30 pounds. It's very good value for money, something like Omron monitors. And arm cuff blood pressure monitors are better than the wrist monitors. So try to buy an arm cuff one, and once you buy it, it lasts several years. So it's a good investment. And when you take the home blood pressure readings, always try to do it for 7 days, morning and evening. If you take 2 readings in the morning, 2 readings in the evening, and if the first reading is too high, ignore the first reading and just take the second reading as your blood pressure. If you are able to take 3 readings, then ignore the first reading and take the average of the second and the third reading. And you have to do it for 7 days, maintain a blood pressure diary, and that will tell you where exactly the blood pressure is. Next slide. And stages, clinic blood pressures are slightly higher than when you do blood pressures at home. So stage 1, I've said 140 by 90. Stage 2, I've said 160 by 100. Stage 3, I've said 180 by 110. But when you do the home blood pressure, or when you had this ambulatory blood pressure monitor, your blood pressure ideally at home should not be above 135 by 85. That is stage 1. And if it is 150 by 95, it's stage 2. And it's severe hypertension if the numbers are 180 by 110. Thank you. Investigations, there are some simple investigations which can be done by the GPs, something like a ECG when you have high blood pressure, because on the ECG you can see some changes of strain on the heart. When the heart has to pump against high blood pressure, it's just like when people go to a gym and lift weights, their biceps becomes muscular. But when your heart has to pump against high blood pressure, it becomes thickened as well. And what we call as left ventricular hypertrophy, that can be picked up on an ECG sometimes. But the scan to have is a heart scan called as echocardiogram. That simple test which can be done in the GP surgery, like a urine dipstick. They dip your urine to look for any protein or blood, because when the blood pressure is very high, it puts a strain on the kidneys, and sometimes protein, which is not supposed to leak, can leak in the urine, and there can be some blood as well. And it's a good idea to check kidney function tests. And when you come to the clinic, I usually check into the eyes, because the small blood vessels are the ones which get much affected with high blood pressures. And later the effect is on the large blood vessels. I haven't been doing the fundoscopy because of the COVID, and we have to be careful with getting too close to the patient. But that's what I would do in non-COVID times. There are other things to check. It's, they say blood pressure is a lifestyle illness, and so is diabetes. Sometimes both of them can stay together. So if your GP ever diagnoses anybody with hypertension, it's always a good idea to check some basics like cholesterol levels, diabetes, your kidney function test. What the illnesses are called as metabolic illnesses, lifestyle illnesses, happen because Unfortunately, in 21st century, we are eating too much sugar, too much salt, too much fat, and all of them can be like pillars of. In fact, if you come to the hospital, the biggest illnesses we see in the hospital are heart attacks, strokes, kidney failure. Those illnesses don't happen in isolation. They are sitting on the pillars, which are diabetes, blood pressure, high cholesterol, and kidneys not working very well. So I think the foundation, if we can always try to be careful about, a lot in the society can come down, and these illnesses can be very rigorously controlled with lifestyle changes, with a combination of medication. Thank you. Thanks. So who to treat? In my blood pressure clinic, I get a lot of referrals for young patients. And young patients, if they don't have diabetes, if they don't have kidney damage, if they didn't have any heart attack or stroke in the past, and there is a way to calculate their 10-year cardiovascular risk, that is 10 years risk of having a heart attack or a stroke. And if they don't have any of this, and if their percentage of cardiovascular risk is less, I usually say lifestyle changes first. I don't give them medications. But say if they're above the age of 80, they're already, their blood vessels are stiff, they had so much of years on their mileage, it's better to treat them than not treat them. But young people, I always advise lifestyle changes first. Yeah, next. But if you have stage 2 hypertension and above, a big proportion of patients who refer to me are also in this stage, unfortunately, young people. I don't have an option but to give them treatment. But a lot of people have done so amazingly well. They have cut down their salt intake, their alcohol intake, cutting down on junk food, and exercising regularly, being very rigorous with their salt. That a lot of people, the blood pressure could be controlled with a little bit of medication and a lot of lifestyle choices. And in severe hypertension, so people ask me one question, why I'm very young, why are you giving me medication? But I don't have any other option when their blood pressure is confirmed as stage 2 or stage 3, because there you can't take any chances. We have had young people come to hospital having strokes particularly, and it's really sad to see young people when they're supposed to be enjoying life outside are in a hospital bed, unable to move and stuff. So it should not be taken lightly, especially when it is stage 2 hypertension or above. Stage 1 hypertension should not be taken lightly as well when they have diabetes, kidney disease, and if they had a heart attack or stroke in the past. Next. Management, for a young patient, I've got half an hour slot, and for a repeat, not young or old, for my first appointment, it's half an hour, and the repeat is 15 minutes. In the half an hour, 15 minutes, I'm just talking about lifestyle, diet, alcohol, exercise. There are certain medications which can make your blood pressure go up as well. So I'm always talking about them. So it's so vital to have lifestyle, to make lifestyle choices. There are a group of blood pressure medications. What the blood pressure societies or the NICE guidance says as ACT. A stands for something called as ACE inhibitors, which act on the kidneys. C stands for calcium channel blockers, which act on the blood vessels. D stands for diuretics, which wash out excess salt from the body. So these are the main medications, and there is a different way to treat different people based on different age groups, ethnicity. And even young women, for example, if they want to have children, I would never give them ACE inhibitor or a ARB, because that can be deleterious to the fetus in the first trimester. If it's an elderly patient, I might choose calcium channel blocker. But sometimes what happens is just one medication is not enough. Sometimes we need two, and some group of patients might need 3 medications. So step 1 is either ACE or calcium channel blocker. Step 2 is A plus C. Step 3 is A plus C plus D. And there are some additional medications which can be used as well, like spironolactone, alpha blocker, or beta blockers. So targets are, last time, I think last year we did not have the British and Irish Hypertension Society meet, but before that I went for the meet, and they were talking about elderly people, below the age of 80, the target is 140 by 90 when you start treating them. But above the age of 80, we are slightly flexible. The blood pressure target is 150 by 90. The reason being, elderly people, if I put too much medications on them, there are lots of side effects as well. And the kidneys are a little bit fragile. Their blood vessels are a little bit sensitive, and too much of medication is also not good. And in fact, in that meet, one interesting that they were saying is, in elderly patients, if they're already on medication, if you want to add blood pressure medications, don't check their sitting blood pressure medication, do their standing blood pressure medication, because what is happening is, also sometimes clinicians can give too much medication, and elderly people can fall down, and when they move around, the blood pressure drops and they can be problems. So we have to be cautious and treat appropriately. Yeah. Complications, hypertension, huge effect on the heart. I've got such a big cohort of young patients who are referred by my colleagues, cardiologists here, with heart failure, and they did all kinds of investigations, and what they found was the main point which was making their heart fail was high blood pressure. So heart is centered to how our body functions, and it's very, very important. Stroke is another thing. I get loads of referrals from the stroke unit here with high blood pressure. It's young patients. Interesting. A few months ago, I saw a patient, and he had a stroke. And I said, how did you end up having a stroke? He said, during COVID, I was working nonstop, as he was an IT professional. And you know what he was doing? He was living with his mother, but mother ended up having a stroke. So she was cooking food for him. So now she couldn't cook, and she had carers. So he started buying foods from Tesco, and Tesco had this meal, which was a sandwich, chips, and a Coke or whatever, I think. So afternoon, dinner, especially when he was working, he used to have non-stop, and his blood sugar just skyrocketed, and he ended up having stroke. I'm not saying that's the only factor, but salt intake, we have to be very, very rigorous with hypertension patients and salt intake. So it can affect the kidneys as well. Again, the loads of patients needing dialysis, their kidneys are not working. The early you recognize this, the better, because a lot of symptoms are subtle, and people are so busy with lives. They have children, they have work, so you always try to ignore this. But I think it's good value for money to have a checkup, especially above the age of 40. You should definitely get your blood pressure checked at least yearly once, just to make sure we don't develop complications in future. Next, please. And it can cause retinopathy and blindness. I remember when I was a registrar at Imperial, I had this young patient who used to take a lot of cocaine, and cocaine stimulates you. So stimulants can also cause high blood pressure, and the high blood pressure completely damaged her eyes. So at a very young age, she became blind. So, oh my God, it's such a life-changing damage to our body. When I was growing up, my brothers used to always say, I was the youngest, so you used to hear sermons all the time. So they used to always say, you are what you think you are. But as a physician, I felt you are what you put inside your body. So what you eat is very, very vital. Sugar, salt. After the age of 50, I'm sorry to say this, but we have to live like a monk. I don't know, you guys have read that book, The Monk Who Sold His Ferrari. It was gifted to me by one of my junior doctors, but fantastic read. But lot of people, when they stop eating salt, sugar, yeah, red meat, and they will say, Dr. Akunuri, you're asking us not to live. What's a life for? They will say that, but after 6 weeks, 2 months, they feel refreshed. Their reflexes are faster, their exercise tolerance is better, their quality of married people who have partners, their quality of life is better. Long term, it has huge implications, and after some time you don't even feel like tasting anything which has too much salt in it. um, Life is not just food, right? But in Asians, I'm from Asian background, everything revolves around food. So, any function you go, any party you go, it has to be, if your plate is not full, you're causing insult to the host. And and so I think it's important, we need to cut down on these things. So when should other causes of high blood pressure should be suspected? I usually do tests to look at the kidney function test, do scans of the kidneys, particularly in young people, if they have below the age of 40, certainly if they're below the age of 30. I look for other causes. Is there any abnormality in the hormonal system which is rising the blood pressure? And these are more technical terms, but as I've said, there are conditions in the body which are producing excess chemicals. They're normally produced in a certain ratio, but if they're produced in excess, that can rise high blood pressure as well. One other cause of secondary hypertension I've found in my blood pressure clinic is sleep apnea. So people who snore a lot and don't have good quality of sleep during night because of snoring, and daytime they're very sleepy. There is a score called as a Epworth score, which is online tool which your GP can do, and that can also raise your blood pressure. So we have referred our patients to sleep clinic at St. George's Hospital to help them breathe better during night with a CPAP machine. That can be other cause of high blood pressure. Kidneys, when kidneys are affected because of any reason, that can also raise your blood pressure up. So as I've said, their condition. These questions were for medical students, so I would leave it for you. But lifestyle choices are important. And so I've gone through definition, classifications, diagnosis, investigation, management, some complications. I always feel, even when I teach junior doctors, to keep it simple. And the simple message is, follow a healthy lifestyle. When you have hypertension, don't ignore it. So I'm open for questions now. Thank you.
Thank you so much, Dr. Akunuri. That was really, I feel like I had to learn so much, so that was brilliant. I know we've already got a couple of questions in the chat, so let me just go through to Jay. Are you happy to ask your question first?
Yeah. Thank you very much, Dr. Akunuri. That was absolutely brilliant. To be honest with you, the only comment that I can make is and I'm sure majority of the people in this audience, when they go to the GP and they get their measurement done or their checks done, and then they are prescribed on certain medication, I vouch that I have never received an informative explanation in the manner that you have provided. So much awareness, so much education. It's not just information, it's educating the patient in a way. So I congratulate you for taking your time and coming into
thank you. Pleasure.
The ARCC Coffee Morning to do that. Really appreciate it. On a personal side, I would like to make an appointment with you, yeah, if I can. But I will go to the GP now and try and clarify some of the information that I need from my GP about, because I do regular 6 monthly checks as a qualification for anybody over 70 or 65. I can't remember when it starts, but I would recommend that for everybody that is in the audience to demand that regular check to measure your blood pressure on a regular basis, but do all the other tests that you mentioned as well to go with it. Because as you say, hypertension is not just related to one symptom. There is a number of factors affecting high blood pressure as well.
Yeah.
My question was related to sleeping, because I do snore.
Yeah, sure.
And I've never thought about really that snoring and the sleep could be affecting the blood pressure as well.
Yeah, thank you. It does, Mr. Patel. What happens is when you snore, your breathing is interrupted. So there are periods where you don't get enough oxygen because your upper airways are compressing for air reaching the oxygen reaching the lungs. So interruptedly you snore and you wake up as well. What happens is whenever the oxygen doesn't reach body, the body goes into a stress which you can't measure it, and that stress causes the blood vessels to squeeze. And over a period of time, people can develop high blood pressure. Now, when people snore, there is grading. So ask your GP for a Epworth score, EPWORTH, Epworth score.
EPW?
EPWORTH. Epworth score. And depending upon the score, a lot of people, the score is fine. They still snore, but it's not worrying, so they don't need anything. But in those people, when you snore, the things to remember is cut down alcohol intake, especially during evenings, cut down heavy meals, and try to lose some weight. That's absolutely paramount. Losing a little bit of weight. The other thing one other thing I wanted to mention you, which I didn't say in the talk. See, when your GPs prescribe you medications, what we have found is 1/3 or maybe more of blood pressure patients don't take their medication. And I can understand that. I can understand because there are lots of side effects. But if you have side effects, your GP is rushed, and he may not have time. There are so many patients to see. And sometimes, the British patients, for being polite, they may not ask, oh, actually, I've got a side effect. That's why I've stopped taking the medication. What happens is GP will prescribe the next medication. The big problem we notice is a lot of patients are not taking their medications as well. But it's important, if GP has prescribed you, to take the medications. If you're not taking, people can get side effects. That's absolutely reasonable. Please talk to your pharmacy and see what are the alternatives. But coming to sleep apnea, cutting down alcohol before you, if you're drinking 2 glasses of wine, it has to be 1 glass of wine. If you're drinking 1 glass, it should be half glass of wine. And because alcohol, a lot of people think it helps sleep. I have a patient whose husband passed away, and her blood pressure was well controlled till the husband passed away. But I think that caused the stress. But she couldn't sleep, so she was drinking alcohol to help her sleep, and that pushed her blood pressure very high. And we have seen in my clinic, we have done a study where we have found alcohol can also make your blood pressure go up. So be careful about alcohol intake. But cutting down weight, being very fit, and trying to exercise regularly, cutting down salt is important. Yeah, thank you.
Thank you very much.
Brilliant. Thanks, Jay, for your question. I just going to pass over to Dax, who had a specific question. Are you there, Dax?
Yes, hi. Hi, Dr. Akunuri. Thank you so much for this fantastic presentation. I have a right bundle branch block, and I was wondering, would this affect me with any heart issues later in life? My son, who's quite young, only 25, also has this condition. And also, are there any breath exercises that we could do which might help us?
Is it right bundle branch block? Is it?
That's right.
Right. See, I'm a hypertension doctor, not an electrophysiologist, but the left bundle branch block is more dangerous than the right bundle branch block.
Okay.
Right bundle branch block with a combination of other things can be worrying, but now I'm talking like a general physician. I've seen few right bundle branch block patients, nothing to worry about. The one question to ask your GP is there a family history of sudden death, or is there a family history of collapse? Those are the things you need to ask.
Okay, thank you.
But right bundle branch block itself is not, I don't think prognostically it is too worrying. We see that often when people have clots in the lungs, but it doesn't affect too much. It's the left bundle branch block which is more worrying.
Thank you, doctor.
Yeah.
Brilliant. I'm just going to pass over to Saroj. Have you got your hand up? I'm just pressing the unmute button. So just push unmute for me. There you go.
Yeah. Hello. It is all very interesting, and I've just recently been trying to work out about fish oil. A long time ago, they used to say taking fish tablets is quite safe or it's quite good for joints and heart and everything. But recently, I've read somewhere that it can interrupt with I haven't started taking it, or my husband, but can it interrupt and cause problems with the rhythm of the heart? Is there any study or anything you can like to know on that, whether to take fish tablets or not?
For an electrophysiologist or a cardiologist, but not that I've heard of. Eskimos eat a lot of fish, and in medical school, when you go to medical school, one of the things you learn is Eskimos don't have heart attacks because they eat a lot of fish oil, and they eat fish which is very blubbery and which has a lot of oil. So historically, fish oil or omega-3 fatty acids, they were supposed to be good for heart. So I haven't heard anything anything untoward there.
It's only a recent study. They were saying that they've done some study from the MAYO clinic that taking fish oil tablets, especially if you're taking aspirin, can cause some sort of function in the heart that might interruption to the medication you're taking, the losartan, Lipitor, and all other medications you're taking. It can have an effect and also might cause some rhythm to.
Do one thing. Why don't you email me? I think from Lizzie you can get your my email address. Why don't you email me that article? I will, obviously I don't want to give you false information, but
no,
read that article and I can look into it and I can get back to you.
Yeah, it's just a very recent study somebody was saying.
Yeah.
And because before I wanted to order fish tablets, I did ask a nutritionist, and she took a note of all our medications. And she said, I think you have to ask a cardiologist or specialist to find out if it's all right to start taking it. Most studies have said it's a good thing, but on very few people, you can have some effect. But how do you know? What do you have to test?
Yeah, I can't answer it on top of my head, but if you can email me, I can look into it and
Yes.
I can get back to you.
And the next question is, if you have a stent put in, how often should you get it checked?
Again, this is a question for the cardiologist. How often do you get it checked? If you have a stent, usually, the things to look for is when you have a cardiac stent, again, I'm talking like a general physician, is if you're getting any shortness of breath on exertion, if you're getting any chest discomfort on exertion, then you should definitely get it checked just to see if the stent has blocked or not. Stents are, the tubes which are put in the blood vessels which supply the heart when there are blockages. Usually they work fine. I can't tell you whether, you do any checkup every 6 months or not, but the most important thing is clinical features. So if you're getting chest pain or walking or exerting, then
Right.
definitely you should get some check.
Yeah. That's a good thing. And unfortunately, I missed the one before. I just wanted to recap on what to ask when you're over 70 and you're taking blood pressure tablets. What was that? Is that possible to recap on that one?
If you're over 70 and taking blood pressure medications?
Yes. What are the checkups other than kidney function and what did you say? Because I missed it.
One is the tracing of the heart, which your GP can do.
Tracing of the heart, okay.
Your kidney function tests.
Kidney function test, yes.
On the tracing of the heart, if there is any abnormality, for
Yes.
echocardiogram.
Then what, sorry?
If there is any abnormality on the tracing of the heart, then a jelly scan of the heart called as an echo.
Scan of the heart, okay. Echo test, all right.
Abnormality on the ECG, because a lot of population has got high blood pressure. So everybody doesn't need echocardiogram or these investigations, because we don't have capacity to do that. But if
Yes.
you have abnormality on the ECG, or if you're developing any symptoms, then you would need echocardiogram, kidney function test, and it's always good to have your eyes checked as well.
Yes. Okay. Eyes checked. I'll put that down. Yes, we've just been to the optician, so that's good. So tracing of the heart is the main one. We've never had that done. So the best thing is to ask the GP for tracing of the heart.
If your blood pressure is well controlled, then nothing to worry about. If the blood pressure is not well controlled, ask your GP, can I have a tracing of the heart? If the tracing of the heart shows any abnormality, then you would need. These are all based on one on top of. If your blood pressure is plumb normal, you're not getting any palpitations, you're not getting any shortness of breath, no chest pains, then not to worry.
Yes. And when you're saying of kidney function, is that a blood test or a scan?
It's a blood test and also a urine dip. They check the urine and the kidney, and that you can get it done by your GP.
Urine and blood test. Oh, thank you very much. That's very, very kind of you. Thank you. It's been very
absolutely absolute pleasure.
Brilliant. Thank you. So I can just see, Namita, you're waving your hand, and I also see Sujata, you're waving your hand. So I'll get to you next. Don't worry, I've seen you. So Namita, I'll ask you to unmute.
Hi, doctor. That was a brilliant info. I'm going to throw my iPhone out of the room because it's working at the same. Oh, that's better. I'm actually on two medication. One is Candicert, and the other one Candicert 60 milligram and amlodipine 5 milligram. I just checked my blood pressure now, and today's recording is 130/78/66. I'm over the age of 80, and one of my GP had told me, he was very informative like you, Indian, and he had told me that I can sometimes stop the amlodipine for a while and then just carry on with the Candicert. So what do you think? Should I stop that? Because I don't want to bother GPs too much.
I think Candicert with amlodipine is a fantastic combination. I have a rule of thumb in medicine as a doctor. Anything which is working, I don't like to change. Anything which is working, I don't like to change it. If your blood pressure is plumb normal, and if it's very good, and that combination of medication is very good. So I wouldn't be hasty to stop because both the medications act in sync with each other. So I think it's a good combination. Unless your GP feels your blood pressure is dropping too much, then you can stop it. Don't do it without speaking to your GP. But I think your blood pressure now is very optimal. I wouldn't change it. If you had been my aunt, I wouldn't change it.
Oh, thank you. And I'm also on aspirin 75 milligram.
Yeah.
This is just like a preventative measure. But I'm very fit and active. I do a lot of exercise. I do Pilates with Lizzie, keep fit, yoga. I try and walk every day for half an hour, despite I've had a lot of total knee replacements and other stuff, but I try to keep myself fit. So I think I should carry on with these two medication, as you're saying. Yes. I don't want to keep on ringing doctors for no reason.
Sure.
But I just thought, since I'm talking to you, listening to your very informative conversation, I wouldn't say lecture, a very informative conversation, and I'm getting all the info anyway, so it's no point ringing the doctor to say, should I now stop amlodipine? Just carry on.
Stop it, I will. Yeah, you're doing very well.
Thank you very much. Thank you.
Brilliant. Thank you, Namita. So yeah, I'll go to you next, Sujata.
Yeah, my question is, I'm on losartan 100 milligrams with hydrochlorothiazide 12.5 and verapamil 120 milligrams twice a day, and I have a large kidney cyst. What do you think of this dosage? Do you think it's very high?
You're on losartan 100 milligrams.
Losartan 100 milligrams with hydrochlorothiazide 12.5 once a day, and verapamil 120 milligrams twice a day.
And your blood pressure is well controlled on that?
now and then it's very high.
Now and then. I won't change it. It's a good combination of medication.
Okay.
Combination of medication. The only thing is, you have a big kidney cyst, should not be a problem. A lot of patients have kidney cysts.
Yeah.
It's important for you to get your kidney function checked frequently. Just sure, because medications are fantastic, but sometimes they can have a deleterious effect on the kidneys.
Okay.
They protect the kidneys. So
Yes.
change it. That's a good combination.
Okay. But that's a good idea about the kidney function test. Thank you very much.
Every 3 to 6 months, I would at least 6 months have a blood test.
Okay. Thank you very much.
Brilliant. Thank you.
Hello, doctor. Thank you for your nice, informative program. Can I just ask you, my son is 39 and he suffers a lot from sleep apnea. And he's quite worried because sometimes he thinks, he's going to die in his sleep. He just can't breathe. So can you help me? Can you give me some advice, if possible, please?
For sleep apnea, the most important thing is, obviously, there are some biochemical tests he needs to get done.
What test? Sorry, say it again, doctor. What test?
Thyroid function.
Thyroid.
Yeah. Test for blood sugar, HbA1c.
HbA1c. Yeah.
A complete blood picture, a full blood count, FPC.
Oh, all right. Full blood count. Okay.
See, important thing in sleep apnea is to lose weight.
Yeah, he's trying to, he's put weight, for some reason, but he's going to gym every day, trying to lose weight. But this morning he talked to the doctor and they said they don't know, they can't do anything about it. He has to go to hospital. But thank you so much, that he can ask for this test,
There is a machine called as a CPAP machine. He needs to qualify for that. The sleep center is at St. George's Hospital.
Oh, okay. St. George's.
If it is a problem, ask your GP to refer him to the St. George's Hospital.
Okay, yeah.
A sleep study. They will do tests on him, and he might qualify. Again, I'm speaking like a general physician, but he
might qualify for what, doctor, please?
He might qualify for CPAP. CPAP. It's a mask which.
All right. Yeah.
Uses sleep apnea. But first and foremost, he needs a detailed assessment done at the sleep clinic.
Okay. No, I will do that because he has to call the doctor again, to see what they can do about it.
Hello, doctor.
Yeah.
Thank you.
Sorry. Hi, doctor. You mentioned a little while ago about having your eyes checked.
Yeah.
Regarding the pressure. Why?
Eyes checked regarding blood pressure. Yeah. So in the back of the eye, there are small blood vessels. Okay, on the retina where the image is formed. When the pressure is high, the blood, when you have high blood pressure, it affects blood vessels, right? Because the pressure in the blood vessels is high. Which are the blood vessels which succumb first? Which are the blood vessels which can rupture easily or damaged easily? They are the small blood vessels. And these small blood vessels in the back of the eye can be damaged, and they can cause blindness and all kinds of problems. When we check a blood pressure patient, it's very difficult to know how the blood vessels are doing, right? I don't have X-ray eyes to see what is inside the body. One of the best ways to check that this blood pressure is putting a strain on the blood vessels is to look at the back of the eyes, because they're small blood vessels. When there is too much of pressure, they can't cope. They either burst or become thickened, or there is lack of blood supply to the retina in the back of the eye. And these are markers to say that your blood pressure is really affecting your body. The same way as when you check the urine sample for blood or protein, because the pressure the kidneys are unable to take and it gives away, and some protein and blood gets leaked.
I see. So is it best then when you go to the opticians to have your eye checked, to ask them to do a photographic a photo of the back of the eye?
They should be able to. Sometimes,
Which they always recommend you do that, actually.
I think it's a good idea, especially if you have a high blood pressure. They may not be very qualified to do it, but majority of times when I go for eye test, they look into the back and say, okay, it looks fine. Yeah, it can be a simple, yeah.
Thank you, doctor. That's brilliant.
Thank you, Priscilla. So are there any more questions? Yep, I can see Suraj and Jay. So go ahead, Suraj, and then I'll get to you, Jay, after.
Hello, it's me back again. I did go to the optician, and the optician offers for £45, my optician, he does a scan at the back of the whole eye. And I think that is worth getting it, he said, once in a while after a certain age. Because sometimes just a general optician's diagnosis is not there, but there's a special scanning machine that he used to see the back of the eye. And that was very reassuring to put my mind at rest. The other thing I was going to say is it is so connected, tension and blood pressure, because I've had stable blood pressure all my life for a long time, just on Lipitor 20 milligram and Losartan 50. But because of the COVID, I had absolutely gone high rocket in tension. And I was even forgetting to measure my blood pressure. And then one time, it's just a regular call from the GP, fortunately, he's told me, have you checked your blood pressure? Because I was mentioning the tension and everything. And it was 180 that day over time. And I could not believe it, that I'd been 140 regular, 139, and I hadn't checked it. So it's worth checking it. And then suddenly, because it was so high, 3-4 days running, she asked me to measure it. I'm just telling the story for other people. And she now has added on lescanadinpin, 10 milligram, on top of Lipitor 20 and Losartan 50. And that seems to be working, but it took about 10 days for the blood pressure to regularly come down. It was quite frightening, because at one point, I couldn't even believe that it was going up to 180, 190. And I didn't know this was happening to me. And it is totally related. Although I was exercising, I had lost 5 kilos in weight because of all sorts, but the tension, I think, was number one factor in getting this. So is that is under control now, hopefully? These are the right medications.
Yeah, they are good medications. They're good medications.
And the only thing is, what I've been getting is some sort of tingling in my hands. Is it connected to this medication?
No, I don't think so.
Oh, so that's a separate issue. So that's not connected to blood pressure or anything like that.
Unlikely. I can't say. I can say it absolutely. It's not a common side effect of those medications. No.
So yeah, so best to carry on. But I would just like to share this with everyone to say, and then since then, there's been updated on yoga, updated on breathing exercises. You just have to help yourself.
Good.
And get some help. So thank you very much for listening.
Really stressed a lot of us, and yeah, I'm a general physician. I'm a blood pressure doctor, but also a general physician. So I'm seeing quite a lot of stress amongst people, and there is so much of uncertainty. We used to always think, hey, we are like the masters of the planet, but we are just visitors on this planet, and we are not here to. All the plants and all the animals might be thinking we are the biggest bullies. But anyway, having said that, I think the most important thing is trying to eat a lot of fruit and veg, trying to listen to good music, make sure the exercise is going on. And I think it's difficult, but I think it's important. I think yoga and all definitely will help. Relaxation and taking one day at a time. Yeah, definitely.
Okay.
Cool. So Jay, do you want to
the comment I wanted to make is related to Priscilla when she asked about the eyeball and the blood vessels. Because I'm on a diabetic and blood pressure medication, one of the things that I requested my GP is to make sure that they make a referral to Croydon University Hospital, especially for diabetic eye screening. And yes, it is very important because that's where they can have, with the right technology and the machines, to measure your blood pressure, not the pressure on your eyeball in relation to the blood vessels. And it is very important that you get it checked, because it's not only the damage to the thin blood vessels that Dr. Akunuri mentioned, it is also the development of glaucoma that is very, very common with diabetic patients. So I would recommend that you go back to the GP and get that referral to demand eye screening, because if you are on diabetic medication, you should do it. Just a regular check. And then now I'm regularly checked, and I had one appointment on Tuesday related to that. So I had to go to Croydon University Hospital to get it all checked. But it gives you a little bit of more control over what you should be doing in order to stay healthier for longer and not go blind. But the other recommendation is basically, it is, as Saroj said, it is self-management of your own health. And if you can take little steps towards healthy lifestyle living, including the diet, the food you intake in your body, the control over it. Dr. Akunuri, I totally agree. We Asians are very bad. And when it comes to food, we are even more what I would call sensitive to what we eat. So it is important that we, as we go along and age, we start controlling that intake.
Cool. So we are gonna have to wrap up. But Anantha, I've seen that your hand's been up for a while. So basically, you're our last question, and then we'll go on to the next part of our agenda. So, Dr. Akunuri, your last question.
Oh, sorry. I thought I'd just come on the video as well. Thank you very much for the lovely presentation and all the information you provided. It's just absolutely brilliant. It's just what I know as well. I was working in the pharmaceutical industry for 30 odd years, so I understand hypertension very, very well, and the drugs administered for the hypertension too. But however, I was diagnosed stage 1 hypertension last year, and the doctor asked me whether you want to be on the medication or do you want to change your lifestyle and do whatever to reduce it. Then what I did is I said, no, I don't want to be on the medication. I'd rather be changing my lifestyle to get it back to normal. And the good news is, after 6-7 months of stage 1, I have come back to reduce the blood pressure from 145 to 131, and now after a year, now is 125. So 125 over 85. The first one was the stage 1 was 145 over 95. So and I made some slight adjustment on my diet. I eaten more vegetables and fruits, as you mentioned. I changed the oil to olive oil on cooking rather than any heavy oils I used before, and regular exercise, walking daily, and sauna as well. Regular sauna helped me to reduce the blood pressure as well. It's just something I want to share with you all, and that's so there is no real question to ask, but just something I want to share, that when you do have that high blood pressure, with the lifestyle changes, you can reduce it to back to normal. And I've been normal for the last few months, and I just want to say, if I keep up my regime, hopefully I can for the longer period. And the second one question I do have to ask is, my husband is on hypertension drugs, and he's been on it for last 3 years. And is there any way he can reverse back to normal by changing the lifestyle?
I think lifestyle changes, as you know, only go to a certain extent. And for some people like yourself, lifestyle would be enough. Obviously, I don't know the phenotype of your husband, so whether if he has had any heart attack, strokes, or diabetes. If he has any of those, then we have to be.
No, he hasn't.
Yeah.
He hasn't.
So
apart from hypertension, he has no other complication.
The only thing is, when I started doing my blood pressure clinics, I used to ask one of the professors in vascular biology as to, why blood pressure medications have to be lifelong. Why can't we stop it? And he said it's to do with the blood vessel remodeling. Once the blood vessels have become stiff to a point, they may not remodel completely. In some people it might do, but in majority of people there is some almost like a locking system where you can control the blood pressure but not completely reverse it. Maybe if he follows good lifestyle changes, if he's on 3, it can come down to 2, but I wouldn't say he will completely come out of the medications. But having said that, that is my experience. My worry is, not you. You have done absolutely brilliantly, and whatever you have said is absolutely fine. I have a group of patients, as soon as the blood pressure normalizes, especially young patients, when the blood pressure normalizes after 3 or 6 months, they've stopped taking the medication. And 6 months later, they've come back as a stroke patient or kidney failure. I've seen this often, and I don't want that ever to happen. So if it ever happens where you have to stop the medication, that has to happen with the blessings and the guidance of your GP. Because some patients, as soon as the blood pressure has come down, they'll say, oh no, actually my blood pressure is fine. It's a huge commitment to take these medications and side effects. They've stopped it on their own accord, and 6 months later they came back with a stroke. Having said that, in stage 1 hypertension, there is more chances to see lifestyle plays a big role. In stage 2 and stage 3, lifestyle plays a big role, but so does medications. But if your lifestyle is very big, maybe the burden of medications we can reduce, but not completely take them away. At least that is from my minimal experience, what I have in hypertension.
Brilliant. I think that's thank you so much, Anantha, because that was a really wonderful way to sort of close that up. So thank you so much. Obviously, I think it's quite clear here that everyone is extremely grateful to you, Dr. Akunuri. Did you want to give us like a final sentence or something to keep in our mind as we go away?
I would always say low salt diet, eating a lot of fruit and veg, exercising regularly, avoiding red meat, avoiding red meat and low salt. Whenever you buy foods, look at the traffic lights. Buy foods which are green, low in salt, low in sugar, low in fat. And olive oil, exercise, yoga, sauna. I will recommend it to my patients this afternoon. But all very good. Okay, thank you.
Thank you. So yes, thank you so much, Dr. Akunuri. So before you all leave, you've obviously attended one of our virtual coffee mornings, which means you do get the great privilege of going into our draw to possibly win one of our mini coffee hampers. So Naeem, are you able to select the 3 names for us? Or I know it's not you selecting them, it's your cool little automatic machine.
I've got everyone's names written down, and I will share the screen right now so we can all see. Hang on, just 1 second. I'll shuffle it before we pick the names. There you go. Quick shuffle. Let's do full screen. Can everyone see it? Is that on the screen, Lizzie?
Yes, yeah, we can see it.
All right, let's go for the first winner.
Yay. Well done. So just make sure you send your address to Naeem. I'm going to put his email in the chat.
Yeah, I'll put them down as well after this. So we've got our first winner. Going to go for the second winner now.
Just to confirm, the first winner was Hemu. Okay.
Yeah. Oh, Well, that seems fitting. I'm glad that Dr. Akunuri won.
I think he's had to go, but yeah, we'll definitely get the prize to him.
That will be nice. We can just send it to Croydon University Hospital.
So we got Swanton as well on the last position. See who's the last winner.
Ah, well done.
Well done.
That's fantastic.
We've
Thank you.
all three winner. I'm going to put down my details quickly up so you can take note of it.
Brilliant. Thank
Second.
you. Well done, winners. So you'll get a little mini coffee hamper, obviously, because we are meeting virtually. It's kind of like so that you can sort of be there as if we were there in real life. Obviously, if you turned up to the Asian Resource Centre, we provide you with tea and coffee. So this is the closest way we can get to that. So I'll let Maman just share with you our next events.
One second. So
brilliant. Go ahead, Naeem.
So that's the contact details to get in touch with me for the hampers. So if you want something, please get in touch with me within next week so I can send them through. You can email me or just give me a phone call and I'll just take down your name and address. That's all. Oh,
thank you, Naeem. Yeah, because if you don't obviously get in contact with him, we don't know where you live. So so please do let him know. Yeah, Maman, are you able to share for our next events?
Yes, certainly. Our next virtual coffee morning will be on Wednesday, the 2nd of June, 11 a.m. to 12:30 p.m. same time, where we will be discussing diabetes and how to manage that. So please make a note of that, 2nd of June, 11 to 12:30. We have an event coming up tomorrow. As you know, many of us are fasting during this month of Ramadan, and we've had requests from a number of our members to hold a session on what is Ramadan. So there'll be a short presentation and Q&A. If you wish to attend, please go to our website and register using the link that's there, and then you will receive the link once you've registered on how to join. That's tomorrow, 6th of May from 11 a.m. to 12:30 p.m. Some of you are already part of our weekly dance therapy and community chats, which takes place every Monday from 11 a.m. to 12:30 p.m. We have a few spaces remaining. If you wish to join, please call Naeem or email him, which is naeem.chowdhury@arccltd.com, and then he can register you for those sessions and give you further instructions on how to join. That's the weekly dance therapy sessions every Monday from 11 a.m. to 12:30 p.m., followed by the community chats, which takes place from 12 o'clock to 12:30 for those that wish to stay back to have a little conversation with us and get an update on some of the stuff that we're doing. Next one was Lizzie, you wanted to discuss about the EPP?
Yes, so a lot of you will have already seen my Expert Patients Programme presentation probably before, so I won't go through all of that again, but just to reiterate, especially because we just had this session on hypertension, that this programme is designed for Croydon residents who have a long-term condition. So that could be hypertension. It's also for anyone with sort of diabetes or respiratory conditions. It's also to support people that might have mental health concerns. So it's and it's completely free, 6-week programme. And I'm just bringing it up today just to let you know that our next 2 courses are coming up. One of the 6-week courses will be every Tuesday starting from the 18th of May. And then the second course will be running on Wednesdays starting from the 19th of May. We have some spaces left for those courses. They'll be on Zoom. I know that there's a couple of people on here who've already gone through the courses and we've been getting amazing feedback. So I can't recommend it enough. I've gone through it myself. And it is definitely like the best course I've ever done. So please, if you've got any condition, I cannot recommend it enough. So yeah, just all you have to do is literally email me. I've put my email into the chat or call me and that's it. They're so easy to sign up for. So yeah, hopefully see some of you there. Yeah, and of course, please do recommend to everyone.
Yeah, I was just going to say the further information is available on our website. So I'm sharing screen now. So under the services, there's a tab for Expert Patient Program, EPP. once you go into that, you'll get more information about the program and the upcoming dates for the courses. Okay.
Cool. Yeah, and it's me coordinating the courses, not necessarily tutoring them, but so it's, you know, you won't be passed through to a stranger. It'll be me that you talk to sign you up, and then the 2 tutors that take your courses, they all have long-term conditions themselves, and so they totally relate to you on that level. So it's not like sort of being talked down from a doctor. It's more about sort of, what's the word I'm looking for? You know, two-way communication. Yeah. So I hope you learned something today from our fantastic speaker today, Dr. Akunuri. I think he gave us so much information. So we will see you, hopefully, some of you I'll see you on Friday, some of you will see you on Monday, and of course, hopefully we'll see some of you for our next virtual coffee morning. So thank you.